Welcome back to the Early Show on CBS. Our very own Dr. Jennifer Ashton is the author of a book that parents of daughters really appreciate. It's called The Body Scoop for Girls, and she marked its publication by sitting down with some typical teenage girls, and she's here to share her conversation. Good morning.
Good morning, Maggie. That's right. 7 bright and inquisitive girls spoke with me about everything from body image to contraception. And while I wanted to help clear up some of the confusion caused by puberty, they taught me a thing or two as well.
Obviously, the majority of the questions that one is to ask a gynecologist are pretty awkward. Hi, guys.
You might want to ask her about puberty.
I think it's really important that girls know what's going on, because if you know what's going on, you can take better care of it.
You guys know that I'm a gynecologist. What does a gynecologist do, first of all?
Up to a certain extent, it's kind of a mystery.
So how many people would dread it if they had to go see a gynecologist for the first time? You would.
Just me?
You're not alone. A lot of patients that I see come into my office and they're like, white knuckle, like they're going to the dentist. And then when they find out that they don't need an internal exam, they start to breathe again and they can relax. As long as you're not having sex, you don't need an internal exam. Now, did any of your parents ever come to you guys and say, we expect that you don't have sex until fill in the blank age, 18, 19, 20, whatever?
No.
No, not a single person.
In this generation, you know, almost every teenager already has sex by 7th to 8th grade. And it's not a
So you know a
surprise.
lot of people.
Yeah. And so it's like if you haven't had sex already, then you're the weird one and you stand out because you haven't.
What type of contraception do you think is the most effective?
Usually, if not always, I tell my patients that they should use 2 forms of contraception or birth control, something like the pill, which is highly effective, and condoms all the time. And what about the birth control pill? What do you guys know about that?
Not much.
So did you know that the pill can be one of the medications used to treat acne?
I never knew that before reading the book.
And were you surprised to learn that the pill can reduce the chance of ovarian and uterine cancer?
My mom thought it caused it. This was a couple days ago. I was like, hey, did you know it can be used to reduce cancer? My mom's like, oh, I thought it caused it.
I have a question, actually. Yeah. At camp, a girl told me, don't sleep with your bra on, it'll cause breast cancer. Is that, what is that?
You know, that's not true. Is breast cancer something you guys worry about?
I remember feeling my breasts and noticing I had lumps. I remember crying that night thinking oh my God, I have breast cancer. Yeah.
Right? Well, there's a lot in your breast. There's muscle and fat and there are glands. Sometimes it can change with your period.
I really did wish that I knew before that and really did know proper, knowledge about the breast.
Things like taking extra vitamin D, even, believe it or not, doing exercise now and in your 20s can help, because you can literally start trying to reduce your risk now.
All right, bye guys. Bye. See you soon.
I'm glad that you were so open and shared so many cool stories.
You guys were awesome.
Thank you very much.
Thank you. Thank you.
And tomorrow you'll meet the mothers of these teens and hear their thoughts about my chat with their daughters, Maggie.
I'm sure that some of the mothers, like me, their jaws dropped when that one girl, Mercy, said that most girls are having sex in 7th and 8th grade.
Right.
We both have daughters. Should I just accept this as a fact or continue to be in denial that my kid's not going to be one of them?
Well, you shouldn't accept it, and we should try everything we can to change it. And we should mention that these girls were not sexually active, the girls who sat down in our shoot, but statistically, 1 out of 5 15-year-olds has had vaginal intercourse. They are having sex. And what I hear from the moms of my teenage patients is everyone thinks it's someone else's daughter. Well, it's one person's daughter out of 5 people. So if it's not your daughter, it's her friends. And the name of the game here is getting out ahead of the ball before that happens, so that you're educating your daughter about why they want to delay premature sexual behavior. It's important for their health. It's important for their social and psychological well-being. And they need to hear that. They need to hear that from their parents, and they need to hear it from a doctor. Exactly.
Raise them right, hope that they choose to wait, but if not, give them the information.
Absolutely.
I read a lot of your book. Thank you for my copy.
You're welcome.
It's not it's not even mostly about sex. There's a lot of other information in
Right,
here.
and that is probably the most important myth that we need to dispel. I think that nationally there's a recommendation by the American College of Obstetricians and Gynecologists that clearly states that girls should first see a gynecologist between the ages of 13 and 15, and that has absolutely nothing to do with sex or contraception or birth control. That has to do with teaching our teenage daughters about their overall health and wellness, and we cover things like breast health, bone health, what you can do for your bones today so you don't have osteoporosis later, acne, problems with your period, and part of that, yes, is why they should delay premature sexual behavior. But it's a huge topic. They need a pediatrician and a gynecologist.
Great. Thank you for the book.
You bet.
My daughter Danielle will read it. She's a little bit older.
Good.
In the meantime, I'm reading it.